Hello everyone, this is Dr. Bozorgi and welcome to the ECG Refresher. Today we are going to look at an ECG from a young lady who came in for palpitations. Just have a pause on ECG and think about it. I will explain it later. The ECG shows wide complex tachycardia. As you can see, it has right bundle branch block morphology with right axis deviation. The heart rate is about 200 or 220 beats per minute. The differential diagnosis of this ECG could be any PSVT with aberrancy, and another rare but important differential diagnosis would be an uncommon form of fascicular VT, namely left anterior fascicular VT. Any PSVT like AVNRT, orthodromic AVRT, atrial tachycardia can spread to the heart with aberrancy, meaning that the electrical impulse travels down with conduction delay instead of normal conduction. However, it is much less common for the left posterior fascicle to be blocked than left anterior fascicle. As you can see here in this image, the left fascicle is much more broad, relatively resistant to damage compared to a slim single tract that makes the left anterior fascicle. And it's extremely rare to see left posterior fascicular block in isolation. It usually occurs along with right bundle branch block in the context of a bifascicular block, like our case. In our case, resting ECG could help. The patient's resting ECG showed pre-excitation, delta wave. As you can see here, it is evident in all leads and it is negative in 2-3 AVF. This means accessory pathway is located in posteroseptal region of the heart. In this case, it was inside MCV, middle cardiac vein. As you can see here in fluoroscopy image of ablation, the ablation catheter here in RAO is in posteroseptal and it is in LAO position inside MCV. The patient underwent successful ablation, and after the ablation you can see the pre-excitation disappeared and the patient's palpitations resolved. Here you can see ECG after elimination of delta wave. There is no delta wave anywhere, and there is some repolarization abnormalities after pre-excitation ablation. So the final diagnosis for the patient is orthodromic AVRT with aberrancy. Thank you for watching. I hope you enjoyed this ECG refresher. Join us next time for more ECG insights.